I'm Andy Logan, and I'm a consultant hand surgeon in the University Hospital of Wales, Cardiff. I decided to become a doctor. My dad was a GP at the time, and he really enjoyed his job. And I got influenced by him, really. And to become an orthopaedic surgeon, I was a medical student, and I went to see an operation where a patient had broken their ulnar bone in their forearm, and the operation was to put a metal plate on it. And it was just so fascinating. I thought, wow, I've got to do that. So I went into orthopedics. And also as a medical student, I used to read up before I went to someone's clinic about the conditions that I might see. And I went to a hand clinic and I read up all about hand trauma that I could possibly find. And when I went to that clinic, I saw loads of things that I'd read up, and I knew what to do with them because I'd read it beforehand. And I thought, this is great. I've got a specialty here that I can read up in a book and then see patients with it, and then I have the answer to what's going on. So that stirred my interest in hands, and since then I've always wanted to become a hand surgeon, which I did eventually. The most rewarding part, I think, for all surgeons is you want your patient's condition to get better, and whether that's with treatment with therapy, advice, giving time, or operating, what you want to see is the patient getting better. And I think all surgeons would like to see that. I try to be honest with what can be done and what can't be done. I try to give as much information as possible and make it understandable for the patient so that they can make an informed choice as to what they want to do. And also, I think my philosophy on operating is that I think you should only have an operation if it's necessary. If you, there are some conditions that pretty much always require an operation if they're to a certain severity, but there are a lot of conditions that you can treat without, and you can treat conservatively with therapy. So I think that's probably what the patients value the most.